Hey everyone, and welcome back to Saarbaan Veterinary Services. We are so excited to be talking to you today about an important topic for all you cat lovers out there. In today's video, we'll be discussing bacterial diseases in cats, focusing on common signs you might see at home, differential diagnoses, meaning what your veterinarian considers, and the drugs of choice for treatment. After all, knowledge is power. Cats are masters at hiding their illnesses. But by understanding the subtle signs and symptoms of bacterial infections, you can help your feline friend get the timely treatment they need. So, let's dive into each group of bacterial infections based on similar signs and symptoms. Trust me, this information could one day save your cat's life. Let's start with the most visible signs of bacterial infections, skin and wound problems. Now, we all know cats love to explore, and sometimes their curiosity leads to minor scrapes, scratches, or even bite wounds from those neighborhood spats. While most of these heal quickly, some can develop into something more serious. Keep a close eye out for any swelling, redness, or discharge from wounds. If you notice pus-filled bumps, we call those abscesses, pustules or scabs, it's time for a trip to the vet. In severe cases, your cat might even develop a fever and show signs of pain, like limping or being hesitant to let you touch the area. Now, when it comes to skin and wound infections, several culprits could be at play. Abscesses, often caused by those pesky Pasteurella bacteria, are quite common. Pyoderma, a bacterial skin infection, can cause those itchy, pus-filled bumps. Actinomycosis, resulting from a penetrating wound, and feline melioidosis, a rare but serious infection, are also possibilities. The good news is most of these infections respond well to antibiotics. Your veterinarian will determine the best one, but common choices include Clavamox, Convenia, or even good old-fashioned penicillin. Next up, let's talk about respiratory infections, which can be a real downer for our feline friends. Imagine having a stuffy nose and a sore throat. That's what it's like for a cat with a respiratory infection. You might notice your cat sneezing, coughing, or having a runny nose. Some cats even develop eye discharge, making them look a bit teary-eyed. If the infection progresses, your cat may have difficulty breathing, become lethargic, and even lose their appetite. Now, several bacterial culprits can cause these symptoms. Feline Bordetella, often spread through close contact with infected cats, is a common one. Chlamydiosis, another contagious bacterial infection, can cause respiratory issues, especially in kittens. And then there's pneumonia, a serious lung infection that can be caused by various bacteria. Treatment for respiratory infections often involves antibiotics like doxycycline or azithromycin. In severe cases, your cat might need supportive care, like oxygen therapy or fluid therapy, to help them recover. Now, let's move on to gastrointestinal and liver infections, which can really upset your cat's tummy. If your cat is experiencing diarrhea, vomiting, or abdominal pain, it could be a sign of a bacterial infection in their gut. You might also notice a decrease in appetite, lethargy, and even weight loss in some cases. Several bacterial baddies can cause these gastrointestinal woes. Clostridial enteritis, often caused by the Clostridium perfringens bacteria, can cause severe diarrhea. Salmonellosis and campylobacteriosis are other bacterial infections that can cause similar symptoms, and they can even be transmitted to humans, so it's crucial to practice good hygiene. Leptospirosis, spread through contaminated water, and listeriosis, a less common but serious infection, can also affect the liver, leading to more severe symptoms. Treatment for these infections often involves antibiotics like metronidazole or enrofloxacin. In severe cases, your cat might need fluid therapy to combat dehydration from vomiting and diarrhea. Let's not forget about those beautiful feline eyes. Eye infections are common in cats and can be caused by various bacteria. You might notice redness in the whites of their eyes, excessive tearing, or discharge that can be clear, watery, or even pus-like. The eyelids might become swollen, and your cat might squint or paw at their eyes due to discomfort. Chlamydiosis, which we discussed earlier, can also cause conjunctivitis, an inflammation of the eye's lining. Mycoplasmosis, another bacterial culprit, often causes mild eye infections, but it can lead to more severe issues if left untreated. Feline tularemia, a rare bacterial infection transmitted through bites or scratches, can also cause eye problems in cats. Treatment for eye infections often involves antibiotic eye drops or ointments. Your veterinarian will prescribe the appropriate medication based on the underlying cause of the infection. Now, let's delve into some of the more serious bacterial infections that can affect a cat's bloodstream. These infections can be sneaky and might not show obvious external signs, so it's essential to be aware of the more subtle symptoms. If you notice your cat becoming increasingly lethargic, losing weight, or having pale gums, it could be a sign of anemia, which can be caused by bloodborne infections. Other signs to watch out for include fever and loss of appetite. Hemoplasmosis, formerly known as feline infectious anemia, is a bacterial infection that affects red blood cells. Cat scratch disease, transmitted through, you guessed it, cat scratches, can also cause fever and swollen lymph nodes. Brucellosis, a rare but severe bacterial infection, can lead to a wide range of symptoms, including reproductive issues. Treatment for bloodborne infections often involves long-term antibiotics and supportive care. Your veterinarian will determine the best course of action based on the specific infection and your cat's overall health. Last but not least, let's talk about neurological infections. These are the ones that affect the brain and nervous system and can be quite frightening to witness. If you notice any unusual neurological symptoms in your cat, such as muscle stiffness, tremors, seizures, or changes in behavior, seek veterinary attention immediately. Tetanus, a severe bacterial infection caused by a toxin that affects the nervous system, can cause muscle rigidity and spasms. Melioidosis, another rare but serious bacterial infection, can also lead to neurological problems. Treatment for neurological infections often involves supportive care, such as anticonvulsants to control seizures and antibiotics to target the underlying infection. Early diagnosis and treatment are crucial for the best possible outcome. We've covered a lot of ground today, and I want to emphasize that some of these bacterial infections can be zoonotic, meaning they can be transmitted from cats to humans. It's essential to take precautions to protect yourself and your family, especially if you have young children, elderly individuals, or anyone with a weakened immune system. Always wash your hands thoroughly with soap and water after handling your cat, especially if they're showing any signs of illness. Avoid letting your cat lick your face or any open wounds. Keep your cat's litter box clean and disinfected regularly. And most importantly, if you suspect your cat might be sick, consult your veterinarian immediately. Early diagnosis and treatment are not only crucial for your cat's health, but also for preventing the potential spread of zoonotic diseases. So there you have it, a comprehensive overview of common bacterial diseases in cats, their signs, differentials, and drugs of choice. Remember, early detection is key to successful treatment, so if you notice any unusual symptoms in your feline friend, don't hesitate to contact your veterinarian. And if you found this video helpful, give it a big thumbs up. Share it with your fellow cat lovers, and subscribe to our YouTube channel, Saarbaan Veterinary Services, for more informative content. Stay tuned for our next video where we'll be discussing viral infections in cats. Until then, stay curious, stay informed, and keep those feline companions happy and healthy.